Good morning. Your House Health Committee is called to order. Today is Thursday, January 26, 2017, and we're in hearing room 4. It's approximately 9:10, and I will have staff note the roll. So today, members, we have one presentation that I am very excited about because it highlights some of the work that this committee has done over the last 2 years, if I am correct. And then we have a number of bills. And just so that everybody knows the order that we will be going in is the first bill, we will hear House Bill 2194, and then we'll go back in order just to meet some people's time requests. So the first bill will be 2194, which will be out of order, and then we'll go back to the top of the list and work in chronological order. So members, any questions about that? Hearing none, we'll have our first guests approach the podium, and today's presentation is on the new Center of Excellence at Banner University of Arizona Tucson Medical Campus, and I'd like to kick it off with Dr. Michael Daines, who is the co-director of the Children's Post-Infection Autoimmune Encephalopathy Center of Excellence at Banner University. Welcome, but you still have to introduce yourself on the microphone.
I will still introduce myself.
Okay, perfect.
Am I on? I hope.
You know what, and also what is working, it tends to be a little challenging. I don't know if you can move the mic to the left or the right of the computer and pull it down, because what's happening is we want to record the presentations for the archived videos so that we can access it on our website. And if you're not talking right into the microphone, nothing gets recorded and nobody can hear.
Punch like this?
Yeah, you're going to, even more.
Okay.
More.
My mother's going to see this.
I know, but hear my voice in the microphone, and you're back
do.
here like this.
Yes.
Yeah, and because otherwise the video is not picking up our presentations, and that would be a shame to miss it.
I will have her call you if she asks about my.
I will write you a letter from the Arizona House of Representatives. Okay.
So thank you, Representative Carter and members of the committee. I really appreciate your time. I know it's a very busy legislative session, and you have a lot of important things to do, but we're really excited about this new center that we've established, and it wouldn't have happened without the help that all of you have given to us. So I just want to start off by giving some background on what it is we do, and the name of my title pretty much tells what we're working with. So this is a set of pediatric neurological autoimmune diseases that we are trying to get under better control, and we're trying to do that through improved treatments and improving treatments, and by education to the community so that there's greater awareness of these problems. Just to give you an idea of the scope of what we're dealing with, in any given year, there's a huge percentage of children that have issues with mental illness. That can be anywhere from up to a fifth of children in a school-age classroom can have mental illness problems. And about a fifth of these are probably related to immune reactions. So children that get a infection and then their immune system attacks the infection, and as a side effect of that, they end up getting neurological disease. So the diseases that we're dealing with have a very specific clinical spectrum. These are children that are usually before puberty. They're children that have a very sudden onset of symptoms. It's like a light switch flipped with the parents. They can usually tell us exactly the day and sometimes the hour that these symptoms started in these children. The children go from completely normal to a spectrum of illness that can be debilitating and require hospitalization. The main issues that we have are problems with tics and movement disorders. So tics are uncontrolled, explosive movements that these kids can have. And there are also choreiform movements which limit their ability to write and impact their penmanship. But they also get issues with OCD and anxiety and depression. They have food refusals because they're afraid their food could be contaminated, or they're afraid they won't be able to swallow. They have extreme emotional ability, and they have severe separation anxiety and just don't want to be left alone. These events almost always occur after infection. Usually the infection is caused by strep, but it can be other infectious agents as well. There are a lot of attempts to control these symptoms with just psychological and psychiatric treatments, but these are pretty much doomed to failure because the underlying problem is an immune issue, not a psychiatric issue. So psychiatric care is important, psychological care is important because we need to help them deal with the problems. But if we want to actually fix the problem, attack the underlying condition, we need to attack the immune system and try to keep it from causing any further damage. So I have a little cartoon I made here just to show what we're asking our immune system to do. So every day, every one of us is covered in bacteria and fungus and all kinds of things that are really gross that we don't want to think about. And your immune system is a barrier that's keeping all of that from causing any problems. And we're asking your immune system to be very specific and very fast. And there's just no way that it can do both of those things. And so we're making antibodies to all these different things, to the bacteria, to the viruses, to the funguses, everything else that's around us. And each one of these has to be specific to one thing. And the specificity of these is amazing. So if you look at keys, we've got, these are my office keys. I hope no one copies them. So there are about 100,000 different possible house keys. So if you took 100,000 keys and walked around your neighborhood, you could unlock people's doors. There just aren't an infinite number of keys that are out there. There are about 1 million different car keys, and there have been cases of people accidentally taking someone else's car, actually, because they happen to have the same key as the car that just looked like their car, basically. When we're looking at antibodies, there are 40 quadrillion different antibodies that your body can make. So each one of you has the potential to make a near infinite number of antibodies. And the problem is that when you make one of these antibodies to fight an infection, sometimes that antibody ends up attacking you as well. Okay, and so the antibodies that we have to the red, to the strep in this case, are also attacking part of your brain called the basal ganglia. And this causes inflammation in the brain, which causes the mood, behavior, and motor changes that we're dealing with. So we have techniques and tricks that we use to try to suppress this immune response and try to prevent these problems from happening. The easiest thing we do is we use antibiotics to try to prevent the infections that we know are triggering it. So in someone that's strep triggered, we put them on anti-strep antibiotics long term just to keep them from getting those strep infections and have that be a problem. For other children, we'll use anti-inflammatory medications, including just regular ibuprofen and naproxen and other things that are available. We'll use steroids sometimes as well, like prednisone, but that has side effects long term if we're going to be using it. And then the last thing we'll think about in terms of immune suppression is using biological treatments like high-dose IVIG, which has an immune modulatory effect. It suppresses the immune response and puts out the fire that your immune system is causing in your brain, basically. So why is this hard? The bacteria that trigger this are everywhere. About 1 in 5 people are strep carriers. So if we cultured everybody in this room, I guarantee there would be at least 5 people that would have strep in their pharynx. And so that's going to cause these children to get re-exposed no matter what they do. Other types of infections, including non-strep things and viruses, things we can't treat or prevent, can also cause this. Antibodies in your immune system are designed to be permanent. So if you've had your measles shot when you were 5, if you're 50 like me, you're still immune to measles. And so your immune system is permanently set up to remember the things that it's been exposed to. So that includes the good things like protecting against measles, but includes the bad things like these autoimmune diseases that these kids can have. So it can take a while to get control over this, even with the best treatments that we've got. And then the last thing is that, and this is where our educational aims are coming in, is that late recognition and delayed treatment can lead to damage and persisting effects, both biologically and psychologically, because it can be very hard on these children not to be able to control themselves. So our conclusions from this were that the neurologic autoimmune diseases have a clinical spectrum that overlaps with a lot of psychiatric conditions, but the one that we're dealing with has a very unique set of features. And that by working with specialists in mental health, developmental pediatrics, immunity, and immunology, we can work at trying to figure out how to diagnose and treat the underlying conditions that associate with this. And committees like this provide critical support to this area of emphasis. We've begun the CPAE already. We started about 6 months ago, and our clinics are full. And as soon as I finish here, I apologize for not staying and watching the rest of the legislative session, but I actually have a CPAE clinic this afternoon that we're going to be staffing to see. Our support for this has come from many places. We've obviously had state-level support, recognition, and funding, primarily orchestrated through this committee, which has been critical. The University of Arizona and the College of Medicine in Tucson have provided funding and resources so that we can support our academic mission related to this. The Steele Center has provided support for research. Banner's provided really critical clinical resources. This is a very staff-dependent disease to treat, and they've been really critical in helping us get the staffing levels that we need to do this. And we're also working with private foundations for support and fundraising to continue the support for this. As part of our academic mission, we've done outreach and education in Phoenix, in Yuma, and in Tucson, and we have other events planned in the near future to make sure that people are aware of this and that the pediatricians in the community can be the first line of treatment, and we can be there as a specialty center for consultation and assistance. The team that we've got is a lot of people, actually, that are involved in this. There's myself in immunology. I joke that I do the immune system, but I don't do the head, and so I have two head doctors that I work with. Dr. Sidney Rice, who's a developmental pediatrician, and Dr. Jane, who is a pediatric neurologist. Both of them are experts in their fields and are critical in making the diagnosis of post-infectious autoimmune encephalopathies. Dr. Gashan, in addition to being the chairman of the Department of Pediatrics, is an immunology researcher, and he and Dr. Keela are both working at trying to find the underlying immune problems so that we can hopefully target this in a more efficient way without having to deal with the risks and side effects of the other treatments that we've got. Our nurses are the front line of our clinic, and they're the ones that are interfacing with these patients every day. Interfacing with the insurance company so that we can get authorization for the treatments. We're estimating they're spending between 20 and 40 hours per patient per insurance appeal process that we're going through. And then our administrative assistant who's working at collecting all of the patient information so that we can do what we need to do to help make patients better. And that's all I have for my presentation. If you guys have any questions, I'd be more than happy to talk about it.
And just because we have three people, and I know time is of the essence and a few bills, if we could get through the three presentations, and then we'll just ask some general questions at the end. Okay, that'd be great. Thank you. Next up, I'll have Kathy Bollinger, who is the CEO of Banner Health Services, and University of Arizona's Dr. Charles Cairns, Dean of the College of Medicine. I think they're going to tag team at the podium.
Absolutely, with pleasure, Madam Chair Carter. Thank you so much for this opportunity. My name is Chuck Cairns. I'm the Dean of the College of Medicine.
And right into the mic. I know. I'm sorry.
No, I'll get closer.
Or can the mic come back further? Like, can we move the computer now off and move the mic back? Oh, or maybe Representative Powers-Hanley could even hand you that mic. There we go. We're just going to improvise here and make it work.
That's what we do, is make it work. So
that is a problem solver right there. Thank you very much.
And appreciate that very much. So my name is Chuck Cairns. I'm the Dean of the College of Medicine in Tucson for the University of Arizona. And it's purely a pleasure to be here to talk about our Center of Excellence, our research efforts with Banner, and to share the podium with Kathy Bollinger, our extraordinary partner. This Center for Post-Infectious Autoimmune Encephalitis is an example of the excellence in research between the University of Arizona, the Banner Health System, and its application of that research to patients and populations. Indeed, as we celebrate the 50th anniversary of the opening of the College of Medicine in Tucson as Arizona's first medical school, we've been able to celebrate a record year of research excellence that is exemplified by this center. We've had a record year for our students. In fact, 20% higher applications to medical schools in Tucson since the Banner merger. We've had a record year in attracting the best students from the College of Medicine in Tucson, the College of Medicine Phoenix, to come to our residency programs in Tucson, including pediatrics. We've had a record year for faculty promotion, 30% higher than 2 years before the merger, and another record. And then finally, research excellence. Just in the 6 months ending through November, just in large NIH grants of $7 million or more, we've been awarded $125 million. That's an unprecedented amount, not only in this college's history, but this university's history. And frankly, that's the research environment that this center has been developed in. Indeed, it is already a national center. It's been recognized as the NIH-approved national epicenter for the treatment of autoimmune diseases. And we fully expect that we can build upon the success of this center so that we can become the center not only in the United States, but across the world for the treatment of autoimmune disorders. So thank you very much for your support. Thank you for this opportunity to highlight its excellence. And I turn over the microphone to our extraordinary partner, Kathy Bollinger from Banner Health.
Thank you, Chuck. Good morning, and thank you very much for the opportunity to just take a few minutes to make sure that you understand the absolute support that Banner Health has behind this particular program that Dr. Daines has spoken to you about. I'm Kathy Bollinger. I'm the Executive Vice President of Academic Delivery for Banner Health, so I have the great fortune of being Banner's face and Banner's representative to this UA Banner partnership that we are now almost ready to celebrate our second birthday for. So what I want to say about this particular center is in order to be called a center, there must be three things happening inside of it. There has to be research, there has to be training of the next generation of providers, and there has to be clinical service rendered. Without all three of those legs present, it's a clinic, it's a service, and there are wonderful places where things like that happen. But this is, as has been defined by the NIH, the only center for this disease condition in the United States, right here in Arizona. And in order for the third leg of that stool to be fully developed and operationalized, Banner is absolutely committed to making sure that we use our resources and frankly, our geography coverage. We provide care in 7 states in the western United States. And we intend, and we have a training schedule to make sure that all of our general pediatricians, our urgent care practitioners, our emergency practitioners, any of the places that these children might present, to make sure that they understand what Dr. Daines and Dr. Rice are doing, and that they can early identify these individuals, consult with our colleagues at the Center of Excellence in Tucson, keep these children home, but managed virtually by our expert consultants in Tucson. And if necessary, the parents would bring the children to Tucson for their intervention. This is really an opportunity to spread something in a very substantial way, and we're committed to do that. And I'll just leave you with one other comment in terms of what this means for Arizona. We at Banner liken this very much to how our Alzheimer's research program started many years ago. And it started with a few people in a consortium, and now I think many of you probably know that Arizona is considered the epicenter for Alzheimer's research. And we are well on a track to do the exact same thing with this disease spectrum. So thank you for your time.
Thank you so much, and thank you for working on this important issue. And I appreciate helping to continue put Arizona on the map in a positive way and being a national and in many ways an international leader on healthcare issues. So next up to the podium, we'll have Mr. Paul Ryan, who helped kick off this incredible effort. Welcome back to the Health Committee.
Thank you, Chairman Carter. My name is Paul Ryan, and while I know I have an amazing physical resemblance to the other Paul Ryan, I'm actually here today on behalf of the PACE Foundation, who was one of the co-founders of the Center of Excellence in Tucson. I'm just going to take a minute. We're trying to keep this within Chairman Carter's time frame, and I would suggest every other person, whoever comes here, should do that. She stays on time. Good for you, Heather. I think that's great. Along with the information that Dr. Daines and Kathy Bollinger and Dean Cairns have shared with you this morning, I'd like to inform the committee of just 2 things of the many things that the center is doing in its activities around the state and indeed the world. First, Banner University Center of Excellence, in conjunction with the National Institute of Health, Stanford University, the University of South Florida, and the University of Minnesota, is participating in the largest study ever conducted to evaluate the success of IVIG treatment for pediatric neurological autoimmune diseases. If successful, this study would be key in enabling full insurance coverage for millions of families around the country affected by the diseases treated by the Center of Excellence. That is an extraordinary activity in the sense that all other studies the NIH has ever conducted, even close to this, have all been in D.C. This would be a multi-university study throughout the country and at our request. That request came from our Center of Excellence, and the NIH agreed to do that. And the second thing that you should be aware of, and again, emblematic of the center we've created and the epicenter of not only the United States but the world for this disease, we're going to put together a seminar in October, hopefully October or November, with the university and our PACE Foundation and Banner hosting a gathering of experts from around the globe to standardize diagnosis, treatment, research, and training relative to the spectrum of children's disorders serviced by the Banner Center of Excellence. This seminar will not only act as a national vehicle for cohesive cooperation on these subjects, but will cement Arizona's prominence as a leader in the field of pediatric medicine for the United States and, again, indeed, the whole world. Thanks for your time this morning, Chairman Carter. If there's any questions for today's speakers, I'm sure they'd be happy to answer them whenever you guys wanted to.
Thank you. And just before we get into questions,
Yeah.
do you want to recognize the people in the audience who are here today in support of it?
Thank you.
If they could just stand real quick so that
Sure.
we can kind of identify them.
There are a bunch of folks that are parents. So
Right.
if-
So would all of the parents and
family
supporters please
members.
stand related? Can we just give them a round of applause and say thank you so much? If it weren't for your incredible support throughout this entire process, we wouldn't be where we are at today, not only in Arizona, but nationally. And I think that's really the point that we need to make perfectly clear to the committee is that we have really forged a new path in medicine right here in Arizona to meet the needs of these children. And this issue is not isolated to Arizona. So I think Representative Lawrence had a question.
My question is for Dr. Daines.
Thank you.
And first of all, I think we owe him an apology.
Uh-oh.
His mother thinks his posture is bad,
Well, now he has a new mic, so we
and
can
we
prove
didn't
that it's
supply
not.
the microphone for you. We apologize.
For your question, I just wanted to echo what Mike and Kathy Bollinger and Dean Karen said. This committee has been absolutely essential, and especially Chairman Carter's work on this and our other pediatric autoimmune committee, to getting this thing recognized again throughout the world. It has been an amazing journey. This center was created in 14 months when it was predicted to take years. And I can't thank you enough, Heather, and the doctors and the leaders behind me have put that together. Remarkable time, and being the epicenter of the world in such a short time is a great honor, but also a great responsibility that we'll take very seriously. Thank you very much.
Doctor?
And Congressman, I'm so glad you were able to break away from Washington.
The cameras do wonders.
I have an eye check coming later. Dr. Daines, and I'm glad there are some parents here. When parents first notice some of the symptoms about which you spoke, do they think it's psychological or medical?
I think most of them probably think it's psychological, and that's where most of them start interfacing with the healthcare system, is with that approach. If you don't know that infections can cause these kinds of mental changes, it's not going to be the first thing you think about. I'd have to ask them, since they're the ones that were really on the front line, but it's just such a surprisingly acute onset of symptoms. But if the pediatrician or the emergency room doctor doesn't know about this, then they're going to get funneled into the straight mental health system, and they're going to get medicated and therapy and all the things that they think are the best for the kids. But if you're not treating the underlying infections and inflammation, you're never going to get them turned around.
At what point, I'm sorry, Madam Chair, at what point does the psychologist or psychiatrist say, this is an autoimmune disease, I better talk to an MD?
Well, hopefully if they're aware of the disease and how different it is from most other mental illnesses, which are usually more gradual in their onset and have different spectrum of disease, hopefully early in the process. But there are a lot of these kids that have wound up spending years in the mental health system before they get to the point that people figure it out. There are probably a bunch that never get to the point that it's figured out and end up just trying to treat infectious and inflammation with psychology, which doesn't work very well.
How sad.
Yeah.
Thank you. Thank you, Madam
Thank you.
Chair.
Thank you very much. Members, any other questions? Yes, thank you. Representative Udall?
Madam Chair, Dr. Daines, how do you diagnose this? Is it just based on how quickly it comes forward? Or?
So in general, it's a clinical diagnosis, which means it's the spectrum of symptoms that they have that makes you make the decision that that's what there is. There are some lab tests that we do that can be helpful in terms of making a diagnosis. There are tests for the autoantibodies that can be part of what triggers this. There are tests for exposure to strep and to other things that we can use to help us make the diagnosis. But in the end, it's 90% of it is the clinical history that we're dealing with that makes the diagnosis. We're working at getting better diagnostic techniques, and that's part of what the research that's going to be happening with us at the center is going to be trying to figure out if there are simple blood tests or biomarkers or other things that we can do to prove that this is what it is.
Good. And
Thank you.
just to follow up,
Representative Udall?
thank you. If, for example, if a young child ends up with this, might the parents not notice the change in symptoms because with a baby? Or
Right into the mic, too.
Yeah,
Sorry.
sure. That's possible. Usually, this isn't something that we see in babies. Usually, it's well, again, part of it is recognition. You might not be able to recognize it because the things we look at are handwriting, OCD, urinary changes, things like that, which would be very difficult to figure out in a young child. In general, it's not thought that this is a disease that happens in the younger kids, but it would be hard to find if it was.
Okay, thank you.
Okay.
And truly, that could be where the Center of Excellence is going to start. One piece of the Center of Excellence is we've done is we focused on in our ad hoc committee is really about educating other practitioners on what to look for. Because if you don't know what to look for, you think you're dealing with a neurological disease, which really could be an infection instead. So, Representative Butler?
Thank you, Madam Chair. Dr. Daines, how important is early diagnosis to the overall prognosis for a child? I mean, if they don't seek treatment and they're delayed, thinking that this is a mental illness, how long?
It's absolutely critical. To have a child suffer with this level of mental illness caused by inflammation and be told that it's just mental illness is not helpful to anyone that's involved in this. So the earlier we diagnose, the less potential damage is going to be done by the inflammation, but also the less damage is going to be done to the child's emotional state by having to deal with mental illness for as long as they're going to have to deal.
This is incredible. I'm happy to keep answering questions, but I just want to be respectful of everybody's time, too. Representative Powers-Hanley.
Real quick.
Sure.
Thank you, Madam Chair. Dr. Daines, it sounds like that it's important for psychologists and psychiatrists and maybe even public health nurses to know about this. Is there outreach to those communities to let them know about the wonderful work you guys are doing down there?
So the Department of Health and Human Services here does have information on the website that is intended for outreach. Dr. Rice and I are doing personal outreach and education to numerous groups. We're both speaking at the School Nurses Convention on Saturday that's happening. So, yes, we're trying to reach every group that we think could be involved in that frontline issue with this disease.
Madam Chair,
Yes, please, Representative Lawrence.
there are kooks, Dr. Daines, out there who are trying to provide cures for these things and doing things like, I have friends who have been told, well, you've got to tear out all the carpeting because obviously the child's allergic to the carpeting, change all the food, you've got to repaint the walls, get rid of the furniture you have, and that's going on with regard to these autoimmunes.
Well, part of the issue here is that there are people that don't feel good, and medicine doesn't do a very good job of explaining to people why they feel good or why they don't. And so people that don't feel well do seek out people that will offer help, and sometimes they end up with less reputable people that offer what seems like a reasonable answer, but in reality is just not science-based. And the goal of this center is to provide the best care we can from a evidence-based perspective that we know works, and then to do the research in finding the next step of what the better treatments are. So we can't rescue everyone from that type of an environment, but it is a significant issue trying to make sure people are doing what is more mainstream and acceptable, I think, with patients.
Madam Chair, I wish we were about 15 years down the line. Thanks, Doctor.
We'll see.
Thank you.
Yeah.
Thank you, members. And we do still have the standing ad hoc committee. And so the good news is that as we feel the need to bring the group back together to discuss next steps, we can do that. But I just want to thank you. Thank you for your physician leadership in this role. And thank you to Paul Ryan as well for being truly just that parent, grandfather, advocate for and for an individual child that has changed the lives of others. So thank you very much for being here today, and look forward to continuing working with you.
Of course, and I gave my email to the committee earlier. If you have any other questions, please just contact me. I'm happy to talk about anything.
Perfect.
Thank you.
Thank you.